Resuming debate, the honourable member for South Okanagan, West Kootenay.
Well, thank you, Mr. Speaker, and I'm happy to speak today on motion M173 that calls on the government to declare November of each year Diabetes Awareness Month. And I'll say off the top that I'll be supporting this motion. Most Canadians are unaware of the diabetes crisis facing our country, so raising awareness of this disease is not only important for the health of Canadians, it's important for the fiscal health of our medical systems. And I'd also like, off the top, to thank my friend Brian Simons, who in his retirement has become a passionate advocate for diabetes issues and provided me with much of the material that I will speak on today. And I want to speak first about this diabetes crisis that's facing Canada, about how we really need to reduce the number of Canadians with diabetes and how we can help those Canadians that are suffering from diabetes deal with their medical issues. And in particular, I want to mention how a public pharmacare system will not only save Canadians money, it will save hundreds and thousands of lives of Canadians with diabetes and other diseases who die needlessly every year because they don't have full access to the treatments for this very treatable but deadly disease. Now, as has been mentioned by other speakers, Canada has a strong history in the world of diabetes, and it's very much a good news, bad news story. We all know the story of Frederick Banting and Charles Best, who with their colleagues James Collip and James MacLeod discovered insulin in the University of Toronto lab in 1921. And that discovery revolutionized the treatment of diabetes worldwide and remains one of the most celebrated medical discoveries in Canada or even world history. Diabetes was formerly a death sentence for young people who developed the disease, but with insulin treatments, now they could look forward to long, normal, and productive lives. We're on the eve of the centenary of that discovery, and you'd think that we'd be able to celebrate that centenary with pride. But unfortunately, the scourge of diabetes is in many ways far worse than it was 100 years ago. And Canada has one of the poorest records in the world, and certainly in the developed world, and it's getting worse. Every 3 minutes, a Canadian is diagnosed with diabetes. The number of Canadians with diabetes has doubled in the last 20 years alone. And right now, 1 in 3 Canadians either have diabetes or have a high risk in developing it. It's an epidemic. If you're 20 years old in Canada, you have a 50% chance of developing diabetes in your lifetime. For First Nations people, that risk is 80%. Healthcare costs of diabetes will top $40 billion by 2029, in 10 years. $40 billion. 30% of strokes in Canada are the direct result of diabetes. It's the leading cause of blindness in Canada. 40% of the heart attacks in Canada are directly result from diabetes. 50% of kidney failure resulting in a lifetime of dialysis are directly related to diabetes complications. 70% of foot and leg amputations. Diabetes reduces the lifespan of people by 5 to 15 years. And about 7,000 Canadians die each year as a direct result of diabetes. They die needlessly. We know how to cure this. We invented it. It's a highly treatable disease. A friend of mine, a young Indigenous man, died in his 20s because of the complications of diabetes. This doesn't need to happen. So what do we have to do? Well, I think, first of all, as the member from Thornhill just stated, we have to listen to Diabetes Canada and the organization that promotes awareness and research on diabetes in this country. They have a detailed plan, well-researched, called Diabetes 360, that could dramatically reduce our rates of diabetes and reduce the significant impacts that it has on the health of all Canadians. It will cost money, but that investment will repay itself 100 times over in savings to our healthcare system. And the goals of Diabetes 360 are that 90% of Canadians live in an environment that preserves wellness and prevents the development of diabetes. 90% of Canadians are aware of their diabetes status. 90% of Canadians living with diabetes are engaged in appropriate intervention, and 90% of Canadians engaged in interventions are achieving their improved health outcomes. Now, I just want to pause here for a moment and talk about the medical nature of diabetes, because there are two main types of diabetes. Type 1 diabetes usually presents early in life. The pancreas stops producing insulin. Patients are unable to automatically manage the sugars in their system. And without access to insulin and proper monitoring of blood sugar levels, patients with access to insulin and proper monitoring, patients can live normal, long, and productive lives. Type 2 diabetes usually presents later in life. It results from prolonged high blood sugar levels, affecting the pancreas and suppressing the production of insulin. If you're overweight and have high blood pressure, you have an increased risk of developing type 2 diabetes. It can often be treated effectively with better diet, more exercise, but it also requires careful monitoring of blood sugar levels and access to insulin. So getting back to what we can do. Well, first of all, the obvious place to attack diabetes is to prevent people from getting type 2 diabetes. We need more community programs to coach Canadians to live healthier lives, to have healthy diets, and exercise regularly. We also need to ensure that individual Canadians know their diabetes status. There's many Canadians who have diabetes today and don't know it, or they are at a very high risk of developing diabetes and they don't know it. Early treatment combined with a change in lifestyle can avoid the medical complications of diabetes and allow many patients to control their condition without relying on insulin. But for those that need medication, we need to ensure that they have free access to insulin. As the member from Thornhill said, it costs thousands of dollars a year to access insulin. And they need free access to the medical monitoring devices that help them manage their condition. That could avoid 35,000 hospitalizations each year in Canada. The truth is, many people simply can't afford the ongoing monitoring costs faced by diabetics. Their doctors ask them to monitor their blood sugar levels twice a day, but their medical plan only covers one check a day. So they only do one check a day, and that results in complications and medical problems and hospitalization. And that risk could see them falling unconscious due to low blood sugar. It could result in the loss of nerve function in their feet or even amputation. They could lose their jobs. A friend of mine was an airline pilot, one of the most prestigious jobs in this country, and he lost his job for life when he developed type 2 diabetes. Many other countries in the world have developed these programs that tackle diabetes from all angles. They're proven to be medically effective and cost effective, and we could save lives and money at the same time. And that brings me to the issue of pharmacare, comprehensive universal public pharmacare. The Canadian Federation of Nurses Union produced a report that found that 57% of diabetics reported failing to adhere to their prescribed therapies due to the fact that they just couldn't afford them. And according to the Juvenile Diabetes Research Association, 830 young and middle-aged diabetics in Ontario each year die because of poor access to insulin every year. This could dramatically change if all Canadians had access to the medicines they need, but they don't. Canada is the only country with a universal healthcare plan that doesn't include free access to prescribed medications. 10 to 20% of Canadians report not filling their prescriptions because they simply can't afford the cost. So Canada should be proud of its history in the treatment of diabetes, the discovery of insulin. But right now we're at the bottom of the pack when it comes to prevention and treatment, and at the bottom when it comes to hospitalizations and needless deaths. We need to turn this trend around. And simple awareness to the depths of the diabetes crisis we are in is a start to that. So I support this motion wholeheartedly. But we need real government leadership and investment in community health programs and public pharmacare to make a real difference in the health of Canadians. We need the government to listen to Diabetes Canada and implement Diabetes 360. We can do this, and we must do this. Thank you.
Yeah.
Resume.